respects to the Ramatush Ohlone elders, past, present, and future, who call this place the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramatush Ohlone community for their strength, stewardship, and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. Now for our Black ancestor appreciation. We acknowledge the exploitation of our Black ancestors who toiled on this land, building America's wealth and freedom, and survived despite never being compensated and being denied their sovereignty. While our ancestors have survived, we also honor and remember those whose legacies were cut short due to genocidal anti-Black violence. We are committed to repairing the harms caused by individuals, institutions, and the US government, and we honor the gifts, resilience, and sacrifices of our Black ancestors by protecting our spirits, seeking light and laughter, leaning into love, and investing in our collective legacy. Thank you, and greetings, everyone. I see some greetings coming in on the chat. We'll now move to our organizational highlight for our webinar today. This month, our organizational highlight is a local organization based in Fresno, California, called the Breakbox Thought Collective, founded and led by Jamila Oliver. Through their passion for the community's youth and overlooked groups in Fresno, they are able to provide culturally responsive opportunities. They critically understand the impact of media, music, and education on our society's perceptions. We encourage you to learn more about how the Breakbox Collective is changing the narrative of Fresno's most overlooked communities by providing programs for digital storytelling of Black lives, youth workforce development, music, healing, healthy and sustainable teachings, and so much more. If you would like to learn more about Breakbox Thought Collective, their programs and what they do, hit the link in the chat. All right, so we are so excited. I am gonna, at this time, turn it over to one of our amazing community champions, Sabrina Beavers, to introduce the campaign.
Hello, everyone. Give me a second as I pull up the slides. All right, everyone. Well, welcome. My name is Sabrina Beavers. I'm the program coordinator for the Black Infant Health Program here in Fresno County. I'm also a community champion as well as an ambassador for the campaign. And I'm going to take some time to give you the backstory of how Voices for Birth Justice came to Fresno County. So one of the things that I want to start is talking about our perinatal equity initiative. Fresno County's Perinatal Equity Initiative, it was an initiative that was started statewide as an effort to accompany the Black Infant Health Program and the services that they provide to Black women and birthing individuals, and was established in 2018. As you know, or those who do know, Black Infant Health is a program that has been around for 34 years, but we can't be all and do all. We do the best that we can with the work that we do within our social support group model. But we realized that there were some services that would be a great complement to the program. So therefore, we can expand our reach in providing resources that would actually help Black families achieve positive birth outcomes. And PEI was that initiative that was able to materialize that. So with that being said, within the 15 counties where we have the Black Infant Health Program, 11 of those counties have the Perinatal Equity Initiative. And they provide supportive services such as doula, projects, fatherhood programs, and an array of other needs to help complement Black infant health. And here in Fresno County, one of the additional projects was a partnership with the Voices for Birth Justice public awareness campaign, utilizing community champions and ambassadors here from the local community. So now we'll talk about the actual public awareness campaign. These are the 7 champions here in Fresno County. We have Brianna Gaines Barrett, who we'll be hearing from later as one of our panelists, who's a certified doula. Kalisha Goodwin, who's a mental health professional. Shadaria Prince, who's also a mental health professional. Renisha McClinton Slack, who's a first-time mom and a active military individual. Desiree Miller, who's a public health professional and birth justice advocate, and then as well as Brittany Wilson, who's a public health professional and birth justice advocate, and myself. We also have 6 ambassadors. I represent for the Black Infant Health Program. We have Dr. Dimitri Ezeuko, who's a community ambassador and physician, Dr. Bridget Blebu, who's a researcher, mom and advocate Nia Parks, Shatanya Nunn, whose story we will hear about shortly, who's a mom with lived experience, and Kendallin Mack Franklin, who is a community advocate as well as a certified doula. PTBI, or the Preterm Birth Initiative, is a initiative that instills nothing about us without us. They make sure that when it comes to research, it includes the community that they're trying to serve and support. They work in the communities with the most disproportionate impact by the epidemic to generate evidence on promising structural and cultural interventions, and a means to prevent preterm birth and improve birth outcomes for babies that are born too soon, which we know is the #1 indicator and risk factor for infant mortality. All that is done is rooted in science. Everything that you see here, screenshots of articles that have been produced, peer-reviewed journals concerning the nature of concern about infant mortality, maternal mortality, and preterm birth. They also partner with a lot of the community resources that are here within the area, such as Fresno Grow's Best Baby Zone, Black Wellness and Prosperity Center, Black Child Legacy Campaign, of course, the Black Infant Health Program, West Fresno Family Resource Center, the Embrace Study, and Every Neighborhood Partnership. The mission. So imagine if all expecting mothers understood that racism, not race, is a risk factor for infant mortality. Imagine if information about preterm birth and how it relates to infant mortality was delivered in a relatable and digestible way. Imagine if the public recognized Black birth justice as a critical health issue affecting their community. Imagine if a campaign could influence rates for positive birth outcomes and helping babies celebrate their first birthday. The original Voices for Birth Justice campaign started in the Bay Area, and over the course of time, 12 weeks worth of 100 interviews, photo shoots, and developing the campaign across 3 cities, Oakland first, then San Francisco, and now here in Fresno. So now getting into the actual campaign itself. And this is where we'll be playing the video for Shatanya's story. Did you need me to stop sharing or to play the video?
Mommy stayed going to the hospital to see you. I couldn't miss anything. I wanted you to know that mommy will always be there for you. You fought your fight for as long as you could. Mommy not upset anymore. Peace you took with you when you left me, I will never get it back. You're supposed to go before your kids, not your kids before you. Prayed and I cried out to God, but I guess it wasn't enough. But I know you couldn't stay. You're my child and will forever be. As mommy continue to try to heal from this, and I wish you was here with me and not in heaven. Anything is better than being on earth. If only I could be with you, but I can't because your siblings need me. Forever and ever, my baby. Fly high, Levon.
Shatanya's story was one of the first stories featured for the Fresno Voices campaign. All the stories in which have been recorded, all the interviews done, all the work done shows the impact of how infant mortality affects families here in the community and across the world. So one of the things we want you to understand, we say the names of Black children because we didn't get to celebrate their first birthdays. We say the names of Black siblings because some of us grew up not knowing them. We say the names of fathers because they too experience grief and deserve support. We say the names of Black babies because they inspire us to advocate for change. And we say the name of Black Infant Health because it is a long-standing trusted resource, not only in Fresno, but throughout the state of California. These are additional advocates and ambassadors. These are some of the components that have been created. If you go to the website, which I think the link will be placed in the chat, you get an opportunity to look at all the stories that were created, and as well as some of the media components. You can also see them on all of the social media platforms. These were the photographers that helped to bring this campaign to fruition. Byron Malik, who's one of the original photographers for the Oakland campaign, as well as Joshua Slack, who's here locally in Fresno. So we did a launch event last May, and these are some of the photos from the launch event. It was held in person as well as virtually. And then Voices on the Web. You can find us at the website. You can find us on pretty much every social media platform. Instagram, TikTok. Primary audiences are those that we are focusing our parents and pregnant women and birthing individuals. And then of course, we're expanding to include providers, the general public, policymakers. Because this problem isn't just a problem that we as a community experience. This is everyone's problem, or at least it should be. We utilize a strength-based perspective. We center on action. We make sure to have ambassador recommended resources. These are resources that they have tapped into and have participated in. We utilize guides and tools to support action, and then we utilize a community vetting and support. And I think that's it. With that being said, I'll now turn it over.
Sorry, my video is acting weird. Mm.
Hey everyone, please hold for just some technical difficulties. But Brittany, are you able to connect?
Yes, I'm unmuted. Can you hear me?
Yeah,
Okay.
great.
So we're good. Everyone can hear me still?
Yes, we can.
Yes.
Okay, just making sure. Sorry about that. Gotta love technology, right? And my video is not acting right, so you get the lovely photo. I think that was taken by our local photographer, if I'm not mistaken, Joshua. So again, I was just stating that it's just amazing to see the work that Voices for Birth Justice has done and where it's come, and just to see where it's going. So we just wanted to make sure we touch base and highlight on that. Now I'm going to be introducing our panelists. First, we have Dr. Ladella, who is a board certified maternal fetal medicine specialist who brings a wealth of experience in the field of high-risk obstetrics to patients here in the Central Valley. She has a passion and desire to address the health disparities and health inequities of African-American pregnant women and actively participates in local community-based organizations and projects focused to improve Black maternal and child health outcomes. We also have Dr. Abush Shamus, excuse me if I butchered it, who is a board certified pediatrician and clinical professor of pediatrics here at UCSF Fresno. As the director of the community pediatrics and public health curriculum for the pediatric residents, she seeks to integrate cultural humility and anti-racism, anti-oppression, health equity, and public health into their medical training, excuse me. Her academic interests include breastfeeding medicine, family-centered care of the newborn, and immigrant and refugee health. And then we also will have the pleasure of hearing from Brianna Gaines Barrett, who is a mother of 2 girls, spouse to an Army specialist, and a certified birth doula. She is a graduate of California State University, Fresno, go Dogs, and has earned a bachelor's in cultural anthropology. She's also a reproductive justice advocate, womanist, and again, doula. She spends most of her free time building relationships with community stakeholders. Her goal is to eradicate infant and maternal mortality by seeking and demanding reproductive justice in all that she does. And I'm going to say thank you all for being here, all of our panelists. And we've heard about the campaign. We just want some of your reflections on the campaign and how you think it can impact Fresno.
Thank you for inviting me to be one of the panelists, and I really appreciate this opportunity to be able to share and answer any questions and give some feedback. And yes, so definitely the Voices for Birth Justice campaign, it started off as a movement that is aimed at improving the maternal and infant health outcomes and of Black and Indigenous people of color communities. So the campaign is basically to raise the awareness about the disparities in maternal and child health. And especially here in Fresno, there is a significant higher incidence of some of the health disparities that we see in the Black pregnant population, especially higher rates of preterm birth that you have already shared initially, but definitely higher rates of Black infant mortality rates, in addition to higher rates of adverse birth outcomes that include the higher rates of cesarean deliveries, even in the low risk population, and higher rates of postpartum depression and significant peripartum complication rates. And so based on the higher complication rate, it is definitely an area that needs to be brought to the forefront in terms of increasing the knowledge and awareness for these moms and parents who are affected. So the Voices for Birth Justice campaign's goal is to achieve some of these improving of outcomes definitely would be very valuable and would make a positive impact here in Fresno. It's already doing that, some of it, and we hope that that would continue. And if you would like me to share some data, I'm happy to share some of the statistics on the some of these adverse birth outcomes.
Thank you. I want to just make sure that the other panelists also have a chance to answer kind of the first question that was kind of put in the air. Sorry. Why is it important to specifically focus on the Black birth in Fresno? And you did touch on that. Just wanted to make sure that the other panelists had an opportunity to address that question before we move on to the next.
I'll go ahead and go. So this is Brianna. So I think it's really important for us to go ahead and focus specifically on Black birth in Fresno because we noticed that Black families have concerns that are very real. For me as a doula, I hear from families all the time. And one of the main issues that I get to hear is that they don't feel like their providers oftentimes are listening to them or understanding their needs and some of their desires for their pregnancy or postpartum experience. And so we just want to make sure that we're giving these families a chance to be heard and to be active participants in their health.
Thank you, Brianna.
Yeah, so just to sort of build on what everyone else has said. So first of all, thank you for the opportunity to be here and to be a part of this important discussion. So I think the ways in which the Voices for Birth Justice campaign here in Fresno can really impact the health of our moms and babies, and especially moms and babies in the Black community here locally in Fresno, is I sort of see there as being three big needs. And the one is really that for health equity, and that it's really just not acceptable for us not to have health equity. And so Voices for Birth Justice can be important in the role that they play in that work. I think also, as Brianna had just mentioned, it gives the opportunity for an opportunity to allow Black women and parents and families to feel heard and to feel safe, especially in regards to pregnancy and birth and raising babies. And then finally, I see that it can play a really important role with educating our healthcare providers, all the healthcare professionals, physicians, but also other people on the healthcare team, and educate them about the health inequities, but more importantly, how we can address those inequities.
Thank you. And correct me with the pronunciation so I do not butcher it anymore.
So my name, so Amy is fine. Abu Shamsia is the last name.
Abu Shamsia. I'm always going to try it. Yeah, good. I got it. Thank you, Dr. Abu Shamsia. All right. And the next question, kind of that we want to just throw out there, and feel free to chime in when you feel led to. What are some local and statewide policies that birth workers and providers can utilize to support Black maternal and infant health?
Yes, so locally we do have the, of course, the Fresno County Department of Public Health working closely with the Black Infant Health, the Perinatal Equity Initiative, and then the Black Wellness and Prosperity Center. We also have from the Department of Public Health, the Fetal Infant Mortality Review Team. And I have participated in all these different programs and organizations. And I can tell that the Fetal Infant Mortality Review has been very useful because we go into depth into reviewing some of these adverse outcomes. And that really helps us to look at the gaps in the care. If there are things that need to be addressed, we are able to bring that to the forefront at a community level of how to make some of these positive changes. And there is a whole big group in the review team that involves different providers from various specialties, nurses and other community partners. So that really helps us to assess some of these barriers that could be there that cause those adverse outcomes. If those are preventable, how can we work towards addressing them for future to improve the birth outcomes here.
Great, thank you for that.
Okay, for me, I would say a local policy, any statewide policy that is going to allow us to help in these efforts would be, for me as a doula, being able to accept clients or families that are considered low income through Medi-Cal. So that's been a huge benefit. And I know that several families are really excited to be able to have a doula. But sometimes just the finances are a huge barrier. So now that Medi-Cal is going to be, covering some of those costs, that's an area that I can work in.
Awesome, that's amazing. Thank you, Brianna. And then just to kind of throw another piggyback question out there, what are some ways that you guys feel medical professionals can improve the way they engage with pregnant people in Fresno, and particularly those of color?
I think some of the barriers with the interaction between the provider and the pregnant, the Black pregnant moms would be definitely what Brianna just mentioned, is having that the doula program being there for the whole duration of the care during pregnancy, not just during their birth experience, but also during their prenatal, antenatal care, because sometimes these moms don't feel like they've been heard when they go to the physician's office or when they go to the hospital. One of the common feedback that we receive is that they don't feel like they're being heard. And then there is a hesitancy to even ask questions when they go to their providers' offices, and sometimes there's not adequate time to discuss everything that would be relevant to address their individual concerns and issues during pregnancy. So having a patient-focused advocate and patient-centered care plan is what I think providers would need to be informed about, educated about. There are providers doing some of it, but I feel it's not adequate and sufficient with the current system. And so I think having a very robust, comprehensive doula training curriculum and program that can help these moms. And also, I think improving the education piece also for the moms, and not to hold back if they have concerns, to voice their concerns, and to be also, it should be an issue of power sharing where both the patient and the provider together are involved in making those decisions. And so that way they would feel like they're being heard.
I agree. Thank you so much for that. For me as a doula, I would love to have a really good relationship with some of the physicians that are doing this work, because I don't want to be seen as a hindrance to the process, more of a complement to the process. And so just for me to have a good working relationship with the physicians, again, that are doing the work, will make me feel more comfortable, will make the families feel comfortable, to know that there's like a level of cohesion, like we're really, we're all in this together and we want to help in the process. So that would be something that I would really, really look forward to have.
And Brianna, I don't know if you know or any of the other panelists, are there any doula programs that are doing it well right now that can be brought to Fresno that you've heard of or are aware of? I do see in the chat, Sabrina had mentioned that there are 2 doula training pilots in Fresno County. So that's amazing. Any of you know their names or any details about those programs?
Yes, there's the Duchess of Doula program that is through the Perinatal Equity Initiative, VIH, the county supported program that has already started their first class, I think of 12 initial class of 12 doulas in that program, and they are connected with the Community Regional Medical Center, where they would be starting their work and getting involved with the patient care. And then the Black Wellness Prosperity Center also has a good, very comprehensive, robust curriculum that also is launching the doula program that's already started the work on that. So we have 2 great community-based organizations working towards this doula training. And one of the things that also we're talking about in terms of improving the care is also the perinatal behavioral health component plays a big role. And so including that also into the training, so that because stress is a major risk factor for some of these adverse outcomes that these Black moms experience. And we want to kind of bring to the forefront the wellness and the perinatal health related issues that can be addressed. So all that also we feel would be very helpful if they can be a strong voice in this doula program to advocate for these moms.
Awesome. Thank you. Someone linked the a Black Wellness and Prosperity Center's doula website. So if you want to check that out. And someone also mentioned that Kaiser has a Black doula training program in Fresno. Dr. Mason put that in the chat. And I see Mahami website linked. Thank you, Perez, as well. So there are some resources out there that it looks like that for doulas and more of a holistic approach, which is awesome because it like Dr. Liddell said, you'll be able to kind of bridge that gap as far as feeling comfortable talking. So that's amazing. Let me go and see, let me make sure I go through the chat. Awesome. So another question just to kind of throw out there. Why is it important, or do you feel it's important to have continuous conversation surrounding the impacts of anti-Black racism within our medical industry complex?
So there has been the historical trauma that we know of in the healthcare related to the Black community. So, so based on the historical trauma, I think, there's that lack of trust also when they go to the healthcare provider. They're not sure if they would, receive a compassionate care, if they're going to be heard, and if things would be explained well. And so that part needs to be definitely addressed. And then we know for a fact that there is a significant health disparity. Even though the Black community is only 5% of the population here in Fresno, the Black infant mortality rate is very high, 15%. And so it's significantly increased. Likewise, the preterm birth rate in the state also, while it is in the 7 to 8% range for the Black patients here in Fresno, it's in the 13 to 14% rate. And that is the most recent health data that we have from the county from 2021. So because of this health disparity with high maternal mortality rates, high infant mortality rates, high preterm birth rates, I feel like that needs to be definitely brought into the forefront with addressing these issues. And there is the implicit bias too, which also sometimes lack of cultural sensitivity to the needs of the community. And then sometimes there is, things are just done protocol driven, not done trying to meet an individual patient's needs. And so a lot of the time, due to the busyness of what happens in the healthcare system, sometimes protocols are what everybody usually goes to as a first route of care plan. But hearing the individual specific concerns and needs and the issues related to that individual patient and addressing those, making it a patient-centered care and not like a generalized care, that would, I think, that all those need to be the reason for continuous conversations and engagement that would be needed to address these with the healthcare providers.
Great, thank you, Dr. Liddell.
So I just wanted to sort of build on that.
Oh no, go ahead.
Dr. I wanted to build on that a little bit more as far as having continuous conversations about the impacts of anti-Black racism in the medical industrial complex. So because this is so embedded, I think dismantling anti-Black racism and its impacts on healthcare and on birth and babies. It's really a collective responsibility. So myself as a white doctor, I've got a very important obligation, I think, to be a part of this and to speak up and to reach out to others and to really support and amplify all the great work that's being done out in the community. And I think one of the things that I don't think we brought up yet, but that's a really important part of dismantling systemic racism as it impacts healthcare, is when I think of my role as a pediatrician, but also in medical education. And so I think making some changes, bringing changes to increasing diversity and especially increasing the presence of Black people in the healthcare professions. It's just, we can't really overstate the importance of having physicians out there that look like all people. And so in medical education, that starts with increase in recruitment, acceptance, selection of people entering medical school, but that's really only sort of the end of a whole spectrum of where this work needs to happen. And so we have pipelines before that. So we talk about pipelines to the health professions. And here locally in UCSF Fresno, we have multiple initiatives, Doctors Academy, Junior Doctors Academy, the biomedical summer program that's available for students. And so that offers opportunities that will support and inspire children of all backgrounds, including Black children, children from other communities of color, and hopefully getting them interested in and giving them opportunities to learn about the healthcare professions. But as a pediatrician, I like to go back even another step further than that and really think about how we can optimize the cognitive and emotional development of our children ages 0 to 5. So it's too late when we're talking about how we can help people get accepted into medical school. When here we have a whole entire population, children 0 to 5, we have health disparities, disparities in opportunities, and all these things can be related to anti-Black racism in society. And so really making the most of policies and programs like universal preschool, like access to really good quality childcare when parents work, access to improved family and maternity leave, and then focusing on safe neighborhoods, on access to green space for these little kids 0 to 5, on clean air and water and all the environmental issues. All of these things in turn are going to help us all as a community to allow and support the growth of healthy children and really optimize their development and allow them to have opportunities to learn about health professions and ultimately to become the physicians that are caring for the generations of tomorrow. And then just quickly to add, if we step even one step further back, we can approach this whole pipeline at the interconception level and think about how we can optimize interconception care. So care for moms and for pregnant people in that preconception time and really offering and supporting the health and wellness at that time. And it's really easy to see how all of this, it's all like looking upstream to see how far back we need to go and how much work needs to be done.
Yes, you're getting so many high fives and go Dr. Amy's in the chat as far as taking it back and looking further and even prior to conception. So there's a lot of Q&A in the chat that we'll get to later on. People are super excited about the information that's being shared. So thank you, Dr. Amy. Yeah, I got another yes, Dr. Amy. And then just to kind of continue the conversation, kind of just pointing out what are the ways as far as that can pertain to anti-Black racism that show up in traditional birthing environments, and how do we kind of combat and address those as well? because a lot of the time, like Brianna had mentioned, you know, that whole holistic options aren't available. So a lot of Black mothers are giving birth in traditional settings. So again, just to reiterate that question, are there ways that it's showing up within that setting, the traditional birthing environment, and how can we combat those?
I think providing some of this environment for those in the hospitals too, in terms of how to make the opportunities to address the concerns that they have. When they go to the hospital, they feel like they are not being heard, or like, say, for instance, if a mom comes in labor and she ends up with a C-section, most of the time, the feedback is that it was not explained why she ended up having a C-section, especially when it happens in an emergent manner. They feel like they're rushed and they didn't have a say in making that decision about the C-section. And we do know that the C-section rate is very high. And so how do we address this? And so I think trying some of the approaches to even the labor management, those changes also will make a difference. And pain management is another issue too. Sometimes that requires addressing. And there is also concern that they have not been adequately treated because of the pain. They were not able to handle the labor very well. So I think just kind of spending time explaining the whole process of what is expected when they come into the hospital, what could be some of the things that could end up requiring special attention. Just having a detailed conversation with these moms definitely would help, just so that they don't feel like they are not being heard, or not basically the lack of trust sometimes that they have when they come. Those are the main things to kind of focus to address that. So the traditional birthing environments, I think, definitely will make a difference. Having those birthing centers where there is that individualized care versus when they go to is more like the tertiary level high-risk environments where things could happen in a more generalized protocol-driven manner. So addressing the individual whole birth plan, listening to their birth plan and focusing on that from a birthing experience.
Thank you, Dr. Ladella.
I agree. Honestly, from being a doula in some of the traditional birthing spaces, I noticed that it's a completely different sort of atmosphere versus doing a birth in a birth center or a home birth. And I understand that the situations may be different, but again, just making sure that the families are listened to when they pose questions, that their questions are addressed thoroughly, and making sure that families really understand the processes and procedures that the doctor may be wanting or the physician may be wanting. That's kind of a big one. I hear families all the time say, my first birth, I had this done and had this done, but I don't know why I had it done. And even in the cases that I have seen, physicians, require or want procedures to be done and do them, even though the patient is saying no. That's pretty hard for me as a doula to sort of just kind of sit and, and just sort of be in that space sometimes. Again, like I said, I want to be a compliment to the physicians. I do not want to hinder the process. I'm not a threat in this situation. Being a Black doula, supporting families, sometimes like you're felt as though you're a threat and sort of pushed off to the side. And so that's something that I know I have experienced. I'm not sure about other folks, but just making sure that, again, the families are understanding when you are explaining something. If they have questions, listen to them. Ask, check for understanding, right? Did this make sense? Maybe you could break things down a little bit better so way families can really get a full picture of all of what's happening and just any procedures that might need to take place.
Thank you so much, Brianna. All right, and lastly, what is your greatest hope as a panelist, a community advocate, doctor, birth worker, all of the above? What is your greatest hope for folks to walk away with after this session, as far as all that has been discussed regarding Black maternal and infant health?
I think everybody needs to understand the importance of promoting health equity and addressing some of these systemic barriers to care. There could be barriers to care because of certain social issues, transportation issues, medical insurance issues. There could be barriers to care because of lack of access to the healthcare. So addressing some of these barriers definitely will help, and taking these concerns to a county level and state level to make some policy changes to address some of these barriers, which could easily be fixed. And then also just engaging the care team into discussions about how some of these barriers can be solved, getting everybody's feedback. And so that's hoping that when we go away from this webinar, that we would be able to focus more on that, and then encouraging the patient advocacy for themselves do that training program. And as Brianna also mentioned, the providers should not feel like they are in the way of the care, but they are complementing the whole process of the care plan. So that ultimately the hope is that when we have these discussions and when we have these meetings, that we would go away from this meeting wanting to make a change in how we view things related to this health disparity, and how we can all play a part and how we can all work well together, right from the community level to the healthcare team, and work together to help these moms and babies. So that's the hope, that we would communicate more and understand this and share the knowledge and educate one another so that we can work well together.
Thank you so much. Amazing points, Dr. Liddell. Thank you.
For me, I would say my greatest hope for folks to walk away after this session is really just to continue the conversation. To keep having these conversations, keep analyzing the data, continue to work towards, a situation or a future that is, inclusive and considering all of our participants, all of the, sort of people that are involved in this process, right? Because it's not just a one person effort, right? We're all needed, we're all desired to really do this work. So just to keep up the conversation and to ask more questions, right? If you come to something that you don't know, who can you reach out to have your questions answered, and how can you move forward?
Awesome. Thank you so much, Brianna.
So I would say my greatest hope for people to walk away with today is, first of all, to remember that there is work to be done for everyone in this area. So no matter where you're coming from, no matter what you do, we all need to be working together with the community, and that includes physicians, nurses, midwives, doulas, lactation support. I know there was a medical student in the chat. It includes you too. So everybody, and there's something that all of us can do. And as we move forward to really focus on care that's relationship-based, that's individualized, and that's strength-based, and work on this together, because I think only if we all work together are we going to optimize the impact that we can make on this issue of health equity.
Thank you so much, Dr. Amy. Got lots of woohoo's in the chat again.
Hey, Brittany, sorry, just to notice, I see a few questions in the Q&A. I didn't know if any of our other panelists might be able to speak to some of these.
Yeah, we're gonna go
questions.
ahead. Yeah, I'm gonna go ahead and pass it off to Shadiria, and we're gonna have a quick Q&A section after this.
Perfect. Thank you, guys. 'Cause I'm like, some of them I can't answer myself, so I'd love
No
to.
problem. Yeah, I see them rolling in. Yeah, I'm gonna go ahead and pass it off now. I just wanted to say again, thank you all so much. We're gonna wrap up the panel discussion in order to transition to audience questions. And I'm gonna pass it over to Ms. Shadiria to facilitate our Q&A.
Hello. You know, there is lots of questions actually in our Q&A right now. I would first like to thank all our panelists for your knowledge, your expertise, and that the work that you're currently doing in our community. So before we get started with that, I just wanted to say my thanks. And I'm pretty sure everyone else is also thankful as well. So let's get started with some of these questions. I see some of them have been answered. So I'm gonna try to start with the ones that already been answered by some of our panelists as well as our community champions. So one of the first questions is, Fresno has a lot of Latin patients with various levels of language restrictions and resources not available to them. Is there anything being done to address the specific needs in the Latin community?
So when we are looking at some of the health disparities across the two hospitals that I am involved with, we are looking at other community-related health disparity also. And so while we are focusing on improving the outcomes for some of the Black pregnant patient population, we are looking at other health disparities and trying to address it from a wider approach on how we can overall decrease these adverse outcomes. And then again, focus on some of the individual areas of addressing each ethnic patient population related issues. And so from a system level at the hospital level, that is being looked at and that is being discussed, and that is, you know, we're kind of coming up with plans how we can change standardized care, bring out some toolkits, and then look at make some perinatal initiatives at the hospital level too, in terms of how we can have some core measures and outcome measures. And so that should definitely address some of that. But I don't know of any specific program that is there, a community-based program that is looking at this patient population. I'm not aware of that.
I do know there are several doulas here in the Central Valley. I'm not exactly sure where they're located, but they are working with this population. I've not worked with them personally, but there are several folks out there. Again, I'm not sure if they have websites or anything like that, or where they're really located, but I do sort of in my network see lots of new doulas sort of springing up with different areas of interest or focus.
Thank you. Okay, I think someone in the chat, I don't want to pronounce this wrong, but I want to say it's Crown Salah, who's a doula in Merced serving that area. So if anyone is interested in that resource, that information is in our chat. I'm gonna move on to our next question. And this is from Candace. So is there any data, and that can be, survey results, studies, patient feedback, where we can see what pregnant people are saying about their care? Of course, I trust in, the anecdotal evidence from the experts here on the call, but is there any hard data that speaks louder? And I believe Sabrina had put a couple of resources already in the chat, but from our panelists, do you guys have any feedback or thoughts on that question?
I can share some slides to show some of the feedback from lived experiences of moms based on surveys that were done. BWPC has carried out some surveys and gotten some feedback on some of the lived experiences, and I would be happy to share that. So I can do a screen share here. So here's, so basically, just kind of some of the feelings that's out there in the community about when they go to see a provider or go to the hospital or a clinic, some of the things that have been shared. There's just wanted to share this slide about, So just kind of sometimes having to even go from provider to provider can be a dissatisfaction among these patients when they're, so things if they're not explained properly and if they have to go from place to place, or when some procedure is done, they're not being heard, or so this is one. There's also here, listening to Black mothers in California. This was so basically a publication that was put out, and that also has a lot of information about their perspective, about their negative experiences, and that also gives us information on their feedback. I don't know if this helps you, but there are resources that you can go to get some feedback. So there are these statewide policies also, the California Dignity in Pregnancy and Childbirth Act. It's a state law, which is a direct response to assist providers to decrease the implicit bias in healthcare. And this bill came into existence in 2019, and it aims to decrease the racial disparities and decrease the provider bias. And there's more data available if you go to that website and read more information on that. And then the SB 65 is again about interventions, and California's Pregnancy Associated Mortality Review Committee to investigate the maternal mortality and morbidity. The doula services has become, as was mentioned, a covered medical benefit. And so that's also added under the preventive services. Yeah.
I know for me, as a doula, when I accept Medi-Cal, there is an opportunity for the families to give feedback. I don't actually get a chance to look at that feedback, but it does go directly, when I work with Anthem, it goes directly to Anthem. I, again, don't know how they use that feedback, but their families are given an opportunity, or I think several opportunities to give feedback throughout the process.
Thank you. Dr. Amy, would you like to share anything?
Nothing to add.
Okay, awesome, awesome. I'm gonna go on to our next question, which comes from Kathy. Where is the highest area of need right now in combating maternal health disparities in Fresno? I see that Sabrina had identified a couple of zip code areas in Fresno, which is 93706, as well as 93727 and 93722. If any of our panelists would like to add to that, feel free.
Yeah, I can share, those zip code areas just so that there's a visual from the Department of Public Health, Fresno County. We have that information. And so just some of this, I think statistics will definitely, having the visual will make a difference too. So I will just share that here. Sorry, just got to the right slide here. Okay. So as you can see, that's kind of the Fresno Clovis area, and it's definitely, yes, in those zip code areas, you can see the distribution there. And just the preterm birth rates for the county of Fresno, the latest data from 2021, significantly. Again, it had dropped in 2020 a little bit, but went back up in 2021. And then just kind of showing by race and ethnicity. So significantly higher for the Black pregnant patient population, the preterm birth rate. So I feel like, if we can start working more towards decreasing the preterm birth rate, this is going to make a big difference. And in some of the data about their high cesarean C-sections, preterm births, low birth weights, infant and maternal mortality. So all these are, And even when we look at the infant mortality rates, the zip codes that you mentioned, so it's kind of concentrated in this particular area, very high infant mortality, or some of the zip codes that were mentioned,
Yes, thank you for the visuals. I think a lot of times we hear it, but to have a visual, that is very helpful. Thank you. All right, our next question from an anonymous attendee. It says, in your opinion, how can medical governing bodies modify existing treatment frameworks so that expectant mothers, especially those from marginalized communities, have better birth outcomes?
Yeah, I think definitely having some of these, we kind of have those daily rounds and huddle rounds and all those things to address, on the inpatient side, we have that where we address some of the high-risk conditions. But I think, bringing into focus the rounds, including this health equity related concerns that we talked about, I think incorporating that into the daily discussions, the routine rounds, to see which of these patients can be identified as higher risk based on the health disparity. I think incorporating that into the rounds would help. And then also for the medical students, also bringing that into the curriculum, teaching them right there in the medical schools, so that it's not something that they would need to learn while they're working, but if they can be taught in medical school itself, that will also help them when they come out of training, to have a different perspective and outlook. And then taking all these, what we discussed, I think sometimes the hospital administrative level also just informing them, updating them, educating them, and bringing the awareness about these to the non-medical administrators of the healthcare system. I think that's going to make a difference also, so that they can support and provide the resources that will be needed to address these issues.
For me, I can really only speak to like the resource aspect, as I'm, not a physician, but just making sure that those resources can be available. That way families can, sort of, of course you can suggest resources, but they can sort of pick and choose what resources they feel that might fit their specific situation, and knowing who to reach out to when needing other support.
All right, thank you. Thank you.
I think while we are talking about the doula training program, also providing for more of the encouraging, like you, Dr. Amy had mentioned about the Doctors Academy program and some of these programs. I think, encouraging more of them into the workforce in the medical field, whether it is on the nursing side or the technical side or the provider side, just kind of providing a way to, especially here in Fresno, I feel like, we need more of them in the healthcare team, starting from the paramedical to the nurses to the providers. And how can we engage them and have more of their participation by opening up, whether it is at the medical school level or the residency training program level or the nursing training programs, including more from this community would make a big difference too.
If I could quickly, I was typing in the chat really quick, but I just figured it'd be easier to answer. I think Jackie had mentioned, I know from about lactation education and training. I know that I do. I know that it is oftentimes worked into the coursework as you're becoming a doula. And then some decide to do more training. But I don't know, again, every doula sort of designates or dictates their area of focus and specialty. So that's, ultimately really up to them. Again, if the problem is like, say, bigger than I can handle, then I have the training or expertise and I would go ahead and make a referral out. So yeah, that kind of just sort of sums that up.
Thank you. I was going to ask that question because I seen it in the chat.
I was gonna say, I do know, I received my lactation certification through UCSF. I don't know if they still have that program, but that's where I received mine at. And it's good for like 5 or 6 years, so.
Thank you. Okay, we have another question. So how can program curriculum be changed to ensure that future medical personnel understand these disparities and have the tools to contribute to health equity?
Yeah, I think this has to be taken up to the leadership of the medical school, reaching to the ones who are involved with some of outlining of the curriculum, the dean and the other leadership of medical school, so that it can be incorporated. Yes, definitely. I don't know, Dr. Amy would like to add something to that here.
Yeah, I think it's important to recognize that for UCSF and the main campus, as well as UCSF Fresno campus, there are many initiatives, and actually a lot of really important changes have already happened. So that's ongoing for medical students, as well as resident and fellow trainees, to have a lot more integrated about anti-racism, anti-oppression, health equity. So regardless of what field that person is going to be going into, but of course that's only for medical school. And so we have so many other health professionals out there too. And that needs to be integrated into those curricula as well. And then the other thing is translating those changes, making sure that they actually impact the practices that happen in the hospital. And so some of this is going to take time. I personally have seen a lot of really positive curricular changes, but then those people have to finish medical school and go through residency and fellowship, and before they actually start practicing as independent physicians. But I think there is reason to be optimistic about many of these changes.
And for me, I mention again, I'm not a physician. However, I think for me, in my background, being in anthropology, it was really important to, again, focus on the Black population. That was an area that I was like really looking forward to. And luckily, I had professors that were willing to bring these topics up. But just seeing in other majors, right? Because again, I'm not a physician, other disciplines, just to, again, to start the conversation, right? To include some of these things in the curriculum, because some health professionals, like myself included, have a different background. So making sure that these areas are visible in other spaces as well, like sociology or, social work, just making sure that we're addressing that while going to school for some of those who take that pathway.
All right, thank you, thank you. So that concludes our Q&A. At this time, I believe we answered all questions. So we are coming upon the end of our webinar. And so again, I thank each of our panelists who came today to share your knowledge, your resources. I believe it was very helpful to the community and everyone who participated in this webinar today. For those who asked questions, if you can, just make sure you kind of revisit the chat so you can get those links and that additional information that you wanted to receive. And at this time, I'm actually going to pass it to Desiree to do our final closing and call to action.
Thank you, Shadaria.
Wait, I'm so sorry. I didn't want to interrupt you there. I'm sorry. There's one more question that was put in there really quickly. If you guys could just look at that one really quick, or someone just answer it, that would be really great.
Okay, I think I can see it. Okay, so in addition to the curriculum change, what can medical students who are not yet on rotation do to be more involved in the community in regards to volunteering and bringing health services to high-risk areas in Fresno? Great question.
Yeah, I can speak for the Black Wellness Prosperity Center. I think Shanti Davis, who is the president and CEO, she would agree that she has already had some medical students volunteering over there. So that's one organization that they can actively participate and get involved with in terms of volunteering with some of their activities. And there is a Black Maternal Child Health Week coming up in April. During that week, there's going to be so many different programs here locally that the students can go and be involved with during that week in April, the second week of April, and can reach out to Black Wellness Prosperity Center, the community-based organization that's doing quite a bit of work. They can be involved. And if they want to also be involved volunteering, take on a research project, they could probably take those on too to address some of these health disparities. Medical students, they like to do some scholarly scientific kind of work, but this could involve the community versus the patients at the health care system. They can kind of combine the two and do some research projects too. yeah.
Thank you. Thank you.
Dr. Amy, do you have any other thoughts on how the students can be involved? Something that you are aware of?
No, I think all of the programs that you already mentioned, I think that there's so much to do out in the community. And so any kind of community-based experience that you can get as a medical student is such a critical part of your medical education. So I would just really encourage you to do that.
One of the things that medical students can do, maybe they can, take Dr. Amy's advice or my advice, but they could go to some of these high schools and give talks too, to bring awareness. They could go to the Doctors Academy program is there that gives talks to the high school students also. So through that, they can prepare some talks on bringing the knowledge and awareness of the significant health disparity in the community. So that would also spread the information across the community through the students at a young age. Yeah.
Thank you. An excellent idea. Thank you. And then I see Sabrina said you can also volunteer and inquire about volunteering with the Fresno County Department of Public Health and the African American Coalition. So great resources, lots of volunteer opportunities out there. All right, I'm gonna pass it on to Desiree.
Thank you, Shadaria. And as my first call to action, I would like to say for everyone who has attended today, if you would like to be engaged with all of the leading organizers and organizations who are participating in infant mortality work, please click the link that was presented in the bio regarding the Black Maternal Health Week coming up that was mentioned by Dr. Ladella. All of the leading organizers will be participating that week, and you can engage meaningfully and really make those networking connections so that you can stay connected to the work. And thank you to everyone for joining our webinar today and for being a part of the collective call to action from the Fresno Voices for Birth Justice community champions. As a community, we believe that it is imperative that we come together in addressing Black birth justice as a collective. It is essential that providers and birth workers take this issue seriously and make the necessary adjustments in their work to ensure that Black patients receive the same level of care and attention as any other patients. We urge you to actively listen to the issues, raise awareness, and educate your staff on the resources available to them. Remember, the patient is the expert of their body, and as providers and birth workers, it is our responsibility to collaborate with them and not dictate. We encourage you to write your commitment in the chat or send an email to a colleague stating that you are committed to changing after attending today's session. Please understand that consistency is crucial in this matter, and we need to work together as a community to find a long-term solution. Thank you once again for your participation, and we hope that you leave today's webinar with a genuine interest in being a part of the solution. In love and community, your very own Fresno Voices for Birth Justice.
Thank you. Thank you very much.
Thank you
Cue
so
the
much,
music.
Desiree. Yay. Thank you so
Desiree.
much.
That was great. Thank you.
Thank you.
Thank you, everyone. I know we have some good tunes to close us out. Selena's gonna put on for us. We thank you guys so much again for coming. This was such an engaging webinar. Thank you to the panelists once again.
Sure.